Hi, I'm Dr. Paul Hodgson, and today we're going to talk about disc injuries and disc herniations. I deal with disc herniations on a daily basis, which means that I deal with people in some of the most severe pain that a human being can be in. I have an incredible amount of compassion for someone who's going through a disc injury. It is not fun. I would not wish it on my worst enemy. So let's talk a little bit about what disc injuries are and why they happen. The most common disc injuries are going to happen in the lumbar spine and the cervical spine, but they can happen anywhere in the spine. And what is a disc? A disc is it's got several functions and features, but it's the tissue in between the two vertebrae. So it acts as a shock absorber. The disc acts as a movable segment, so the bones can actually shift and move around the discs. And the disc also creates space so that there's more room for the nerves to travel and from where they come from to where they're going. As we age, it's true that our discs tend to get a little bit thinner as they get dehydrated, and then with different injuries and problems that we occur, they can get a lot thinner. We call this process degenerative disc disease or degenerative joint disease. Also gets lumped in with osteoarthritis. It's a form of osteoarthritis. So disc injuries can happen all at once, like a traumatic car accident or a slip on an icy street, but they can also happen slowly from sitting with bad posture or from abnormal biomechanics. It's very, very common for someone to come in and tell me, I don't know what happened. I bent over to tie my shoe and it felt like somebody shot me in the back, and then I had shooting pain and burning down my leg, and problems going to the bathroom, problems with sexual function. These are all things that could happen with disc injuries. Now, the reason why a disc injury can cause so many other bad problems is because the discs are right next to the nerves, and the nerves literally control everything there is to control in your body. And sometimes we take our body for granted until we actually have a problem with the nerves. Then it becomes obvious how much they do for us. The process of educating the patient about what they're in for first involves me figuring out as much as I can about their particular disc injury. We have a lot of different types of conditions that can actually mimic disc injuries, but we don't actually have a problem with the disc. The definitive way to get a disc diagnosis or a disc herniation diagnosis is to take an MRI. Sure. A lot of times people's insurance is not going to want to send them in for an expensive diagnostic evaluation like an MRI. So we're left to do our best guess with things like x-rays, which show us actually everything but the disc. They show us the bones moving around the disc, the joints, but not the disc itself. When we get an MRI back that shows that we have a disc herniation, the question becomes, what do we do about it? The standard medical model to treat disc injuries is usually going to be to start with conservative care, and that basically means everything but surgery. The types of conservative care that a person might go through is they might try drug therapy, they might try acupuncture, they might try chiropractic, they might try physical therapy, they might just try ice and rest. What we've found is that chiropractic is one of the most effective ways for treating a disc injury. The experience that we've developed at New Wave Chiropractic in treating hundreds and hundreds of disc injuries has really helped us to help people faster and help people more efficiently with their disc injuries. Yep. Having a chiropractor or a doctor who's very familiar with disc injuries and who has very high success rates with disc injuries is crucial to getting a good outcome for your disc herniation or your treatment. One of the things that we do in our office is we may do gentle adjustments to start out with, increasing the amount of force that we use as we make sure that your body can tolerate it over a series of adjustments. We may also be looking at getting your hips and pelvis totally level so that you're not putting increased stress with every step on the disc. And then we have to look at lifestyle things like how much are you sitting, what posture are you taking when you're sitting, sometimes how are you walking, how are you sleeping, those kind of things. We're lucky in our office to have a piece of technology called a Class 4 laser. It is one of the most powerful tools that we use in addition to chiropractic to help us heal disc injuries. The laser does several things. It lowers inflammation. Our laser penetrates 8 inches into the tissue, so even on a very, very large person, these frequencies are reaching the deep disc, which is hard to get to in a normal human being. Most people don't know this, but discs also lose their blood supply around the age of 7 or 8, which means that they have no blood supply coming into them, no oxygen source, and no way to remove waste products. The only way that discs get nutrients and oxygen into them is through motion. It's a process called diffusion, and it's slower than if they had dedicated blood supply. This is one of the challenges with healing a disc injury, is that we don't have that blood supply if you're past the age of 7 or 8, which most disc patients don't. One of the other pieces of technology that we have in the office that is really, really helpful with helping with disc injuries is a decompression type table that is called a flexion distraction table. The flexion distraction table effectively straps the patient in, and we specifically target the disc that needs to be rehabbed, pulling the patient apart gently and slowly, and then allowing them to come back together. Gently, slowly pull them apart, allow them to come back together. This again helps bring nutrients and oxygen into the disc and helps pull away waste products in a disc that doesn't have a normal blood supply, which is every adult human being. The more that we learn about how to treat lower back pain, sciatica, disc herniations, the more we realize that surgery should be an absolute last resort. Even surgeons, orthopedic surgeons, want you to try everything before surgery because we know that the outcome is so bad with surgery. Now, one of the challenges with a disc injury is that patients are in the worst pain they've ever felt before. And this, if you've ever had a surgery in your life, this would feel like the time that you need to do it. The problem is we're looking at surgery like an event, not like a process. And what patients need to realize is even after the event, the surgery, there is a long, long recovery process. And there's actually a diagnosable insurance code for failed lumbar surgery. That's how common this is. So while people go in 10 out of 10 pain and expect to come out feeling somewhat better, oftentimes that's not the case, unfortunately. So before we go in there and start cutting structures that will forever leave scar tissue behind, leaving the risk of infection, and we want to always try a conservative approach first. Chiropractic falls into the category of one of the most important things to try before surgery. And I would say even if you've tried chiropractic, you really need to try with several different offices and approaches, because like medicine, there are many different approaches to the same problem, and chiropractic is no different. The biggest question when you're going through severe 10 out of 10 pain that's caused by a disc herniation is it appropriate to go to a chiropractor? Is it safe? Our office can handle every type of disc injury in terms of diagnosis, and some of them are not going to be appropriate to be treated with chiropractic, but we always want to identify that before we treat the patient. Over 90% of disc injuries we're able to handle in our office, and the very small percentage that we're not able to handle, we refer out. If you're suffering from a disc injury, our office is absolutely a great place to start. You don't necessarily have to go to the emergency room. You don't need a referral. You can come right into our office and we'll take care of you.